Hello, greetings from Lahore, Pakistan. I am Dr. Hafiz Awais Nawaz. I have been associated as a faculty member with the Institute of Pharmaceutical Sciences, University of Veterinary and Animal Sciences, Lahore, Pakistan. So today, on behalf of my team, I would like to present on the topic of evaluation of drug-drug interactions among pediatrics in tertiary care hospitals, finding from Pakistan. So we can call the drug-drug interaction as when it occurs when the two or more drugs react with each other. Such type of reactions can be safe, but sometimes some adverse drug events based on these DDIs can lead to the severe morbidity or the mortality. So FDA reports almost 2 million type of the adverse drug events in the USA each year. So that's a huge number. And that can go up to the killing of approximately 100,000 people each year. That's a huge number. Out of these, 35 to 40% of these severe ADEs are preventable. We assume that, and that 5 to 35% are caused by only because of the drug-drug interactions. We believe that there is an opportunity to improve the health outcomes by employing the medication reconciliation process that effectively prevent these drug-drug interactions. We also believe that among many type of the reasons, polypharmacy is a big reason for these type of the drug-drug interactions. And why we have these polypharmacy available among the patients. For example, if you have an upset stomach, you go to the gastroenterologist. That pill from the gastroenterologist can ease your stomach, but that can lead to some itchy rash. You go to the dermatologist, and that pill again can ease your rash, but can cause depression or some type of the other problems. You go to the psychologist to treat those problems, but that can cause some other problems in you. So this cycle goes on. So the ultimate problem that happens afterward is the uneasiness of the patient and the less trust on the medication system. So the aims and objectives of this investigation was to identify the drug-drug interactions in hospitalized patients, and this is a specialized one for the pediatric patients. We want to also associate these drug-drug interactions with polypharmacy, many of the medication that has been co-prescribed within the same prescription. We would like also to categorize the drug-drug interactions according to the severity as a minor, moderate, or the severe type of the drug-drug interactions, also on the basis of the pharmacokinetic or pharmacodynamic type of the interaction. We also wanted to identify the patients and practices at the increased risk of the potential drug interactions in this regard. So how did we do that? It was a cross-sectional prospective analytical study, and that was performed at the Pediatric Tertiary Care Hospital in Lahore, Pakistan. The overall duration was 4 months, and almost 300 patient prescription orders were examined. Data was collected from the patient medical files about the previous and the current medication history, and the drug interactions analyzed through the interaction checker on Medscape interaction checker. We know there are many available, but we check from the Medscape. So the drug-drug interactions were also categorized on the basis of the severity levels, also on the level of the pharmacokinetics or the pharmacodynamics. So what we found initially was that most of the patients that had these type of the problems, they belong to the early in the age from the 1 month to 5 years of age. Also, only there were lesser number that belong to the 5 year to the 10 year, and also some that belong to the 10 years to the 14 years, as it is the pediatric hospital. So the maximum age limit was 14 years. So no other patients were also there. Also, the distribution of the number of the drug examined in the prescription was only there were 10.7% of the prescription that had 1 to 3 number of the drugs available within the same prescription. There was a good number, about 32.7% that had 4 to 7 number of the drugs in the same prescription, and more than 50%, 56.7% was a prescription that had more than 7 number of the drugs available within the same prescription. You can see it's a huge number that most of the prescription had high number of the drugs within the same prescription. Also, if we can say that, also we checked for the number of the drug-drug interactions available in them. Yes, there was a high number with the less number of the drug interactions, but there was a huge number that had the higher number of the drug-drug interactions available in them. And as you can see that if there are one drug-drug interaction, that could lead to the problem. And if you have more number of the drug-drug interaction, that could be very unsafe for the patients. Also, we categorize them on the basis of type of the severity. So there were lesser number of the drugs that had the minor type of the interaction, but there were huge number that had the moderate to severe type of the interactions available. Here, I'm just representing some of the drug-drug interaction with the high prevalence percentages here. If you can see, the first one had the ceftriaxone interaction with the calcium gluconate. That was the severe one, could lead to the precipitation in the lungs and kidneys. That was on the basis of pharmacokinetic, but there were many who were based upon the pharmacodynamic type of the interactions, and all of these type of the DDIs that could lead to the increased toxicity of the other drug that was co-administered. So that's a good number. If I can summarize that, so moderate to severe drug-drug interactions were found, and there was a high incidence of the percentages of polypharmacy available, more number of the pharmacodynamic drug-drug interaction than pharmacokinetic type, and many interactions have been reported before. That's a dilemma. Polypharmacy has been considered as a major challenge for the DDS, and we can assume that, we can suggest that the electronic prescribing can be adopted with the automated DDI checker that could lessen the number, the percentages. Appointment or the involvement of the clinical pharmacist can also lessen these such type of the problems, and the continuous training of the physicians and pharmacists is recommended. So these are some of the references that I have utilized during the preparation of this presentation. I would like to acknowledge the MSPP for decorating such a good platform and providing the opportunity. I would like to thank my team, especially to my Director of the Institute of Pharmaceutical Sciences, Dr. Tahir Mahmood Khan, for his motivation, and also to my university and HSC for all the things that are happening today in Pakistan in the universities. Thank you very much.